For our armamentarium, we're going to start with our PPE. That's our gown, our gloves, our goggles, our mask, and our face shield. We have our marquee probe, which is in 3mm markings up to 12. We have our UNC probe, which is in 1mm markings up to 12, and our UNC probe, which is used for furcations. We have our dental mirror as well. Then we have our patient PPE, which is our patient bib, patient goggles, our bib ease, our saliva ejector, our air water syringe, our HVE. We have 2 gauze, floss, and our tray with liner. We have our cotton tip applicator with Vaseline as well. The Marquee probe is an assessment tool. It has a simple, flexible shank. It's circular in cross-section. Its working end is blunt and rod shape, and it has no cutting edges. The periodontal probe is used to determine the health of the periodontal tissue. It's used to find bleeding and suppuration. It's used for making intraoral measurements. We use the probe to measure oral lesions and to measure recession. The probe is used to measure cal and open contacts in places where food impaction may occur, and it measures pocket depths and the sulcus. It's also used to find frenal involvement, and it's also used to check for mobility by taking 2 ends of a single-ended instrument and rocking them back and forth on a tube. To find the longitudinal relationship, we would compare our current probe readings with the previous probe readings. And to find the mucogingival relationship, we would compare the different sections of the mouth and their probe readings. Before beginning the assessment, we would also ask our patient if they have had any previous periodontal issues or gum disease. All right, we have our Marquee probe. It's double-ended and unpaired. We have our handle, we have our shank, we have our working end, and we have the lateral borders of the probe. And 24 facial. And then 30 lingual. 30. I guess it would be like this. Once we're done with our skill assessment, we would state maintain asepsis.